Dr. Rashi Nigam. Today I will teach you anatomy of lung and related Viva questions. Okay student? Today we will discuss the anatomy of the lung. Okay. First we will discuss the presenting part of lung. Before that I want to tell you the lung is rosy pink in babies, children, but it is dark slaty grey color in adults. Why? Because of carbonious particle deposited in the stroma of the lung. So its color is dark slaty grey. Now we will discuss the presenting part. The presenting part of lungs are apex, base, anterior sharp border, posterior blunt border. Apex, base, anterior sharp border, posterior blunt border. बच्चों हमेशा जब भी आपको लंग का साइड डिटर्मिनेशन करना है आपको यू शुड होल्ड योर एंटीरियर बॉर्डर ऑन एंटीरियर साइड, पोस्टीरियर बॉर्डर, ब्लंट बॉर्डर ऑन द पोस्टीरियर साइड, अपेक्स ऑन द सुपीरियर साइड एंड बेस ऑन द डाउनवर्ड. Don't go for with the help of the fissure. Okay, anterior border on the anterior side. So this lung is belongs to right side. This is the apex. This is right side, right border, anterior border. This is the posterior border. This is inferior border, and this is the base. Okay. So each lung has three border: anterior, posterior, and inferior border. Each lung has apex, base. Each lung has surface. Three surface: costal surface, medial surface, and the base is also called as diaphragmatic surface because it is in relation to the diaphragm. Just below the pleura, what is present in our body? Diaphragm. So this is the diaphragmatic surface. Costal surface, in costal surface you can see some depression. This depression is because of ribs. In between the depression, elevation is because of intercostal space. The depression is because of ribs, and in between the depression, the elevation is because of intercostal spaces. Okay. Apex. Now come to the apex. Apex is not a point; it is a part of the lung. Okay. It is not a point; it is a part of lung. Apex. Costal surface, medial surface, base, apex. Right lung. This is the left lung. In left lung, two important structure. On the anterior border we can see this projection is called as lingula, and the notch present here it is called as cardiac notch. Okay, because tongue like projection, so it is called as lingula, and the notch is present is called as cardiac notch. This is the anterior border, posterior blunt border, costal surface, medial surface, base or diaphragmatic surface. Anterior border, posterior border, inferior border, that is circumscribed inferior border. Okay. So बच्चों, now come to the apex of the lung. This is the part of the lung which is present above the impression of the first rib. So there is the impression of first rib, above the impression of first rib. This is the apex of lung, part of lung which is present above the impression of the first rib. Okay. Now come to the mediastinal surface, that is very much important for your Viva. In mediastinal surface you can see some impression. So first you can see arch. This arch is because of arch of azygous vein. Arch of azygous vein drain into the superior vena cava. So this impression for superior vena cava. Just behind this there is impression of right brachiocephalic trunk. Behind this there is impression of the trachea. Because trachea is somewhat deviated on the right side. So there is impression of trachea. Now come to here, this is the cardiac impression. This cardiac impression is because of right auricle and right atrium. Okay. Now come to the this hilum structure. This is called as hilum. This is called as hilum of right lung. Here you can see pulmonary artery, pulmonary vein and bronchus. So now I will tell you how to identify the bronchus. When you press the lung, you can see the water is coming out from some vessels. You can see. So this is the bronchus. This is the right lung. So there is eparterial bronchus. Eparterial means above the artery. This is the pulmonary artery. Above the pulmonary artery, it is eparterial bronchus. Okay. When we press, the water is coming from this eparterial bronchus. Here you can see after the artery, this is the hyparterial bronchus. Okay. You can see this water is coming out from this bronchus also. So this is eparterial bronchus, pulmonary artery, hypoarterial bronchus, and just below this there is a pulmonary vein. Okay, so this is the pulmonary vein. You can see small structure. This is the pulmonary vein. Epiarterial bronchus, pulmonary artery, hypoarterial bronchus, then pulmonary vein. And one more point for identify the bronchus. When you feel the bronchus inside, you will feel the gritty sensation because of cartilage of bronchus. Okay, you can feel the gritty sensation because of cartilage of bronchus. So epiarterial bronchus, anterior above downwards, epiarterial bronchus, pulmonary artery, hypoarterial bronchus, and pulmonary vein. If we move from anterior to backward, before backward we can see the pulmonary vein. You can see this is again pulmonary vein, pulmonary artery, and bronchus. Valve, pulmonary vein, pulmonary artery, and bronchus. Okay, now come here. On the left side we will see the mediastinal structure. So you can appreciate again one arch is here. In right side arch is for arch of asparagus vein. In left side this arch is for arch of aorta. Okay. Below you can see descending thoracic aorta. Above you can see this is the one branch of arch of aorta, that is the left subclavian artery. Okay. Left subclavian artery. Come to the cardiac impression. This cardiac impression is because of anterior surface of right ventricle and some part of anterior surface of left ventricle. Okay, this is the cardiac notch, this is the lingula. Okay, now come to the mediastinal structure. In mediastinal structure there is only one bronchus. So above this is pulmonary artery, then below that bronchus, only one bronchus, pulmonary artery, bronchus, then pulmonary vein. It is cut off. This is the pulmonary vein. Okay, and before backwards vein, bronchus, vein, artery, then bronchus. Okay, बच्चों कभी कभी स्ट्रक्चर ऊपर नीचे होते हैं क्योंकि कटिंग के ऊपर डिपेंड करता है कि आपने कितना पास से हाइलम स्ट्रक्चर्स को कट किया. ठीक है, तो आपको पहचानना आना चाहिए. Bronchus I will show you. When you crepitate the lung, you can see water is coming out from the bronchus. Okay, and second thing is gritty sensation. When you feel, you can feel the cartilage of the bronchus. Okay, just above it you can see the pulmonary artery, and look at the wall of pulmonary artery and vein. You can see the thick wall for pulmonary artery and thin wall for the pulmonary vein. Thick wall and thin wall. Okay, so this by this we can differentiate between pulmonary artery, pulmonary vein and bronchus. Okay, impression, arch of aorta, subclavian artery, left subclavian artery, descending thoracic aorta. Just behind the descending thoracic aorta we can see the impression of esophagus. Full length we can see the impression of esophagus. Behind the esophagus one more important lymphatic duct, that is the thoracic duct. Okay, thoracic duct. Anterior to the subclavian we can see subclavian vein also. Left side subclavian vein. This is subclavian artery, this is subclavian vein. Okay, now I think it is okay. Complete discussion and Viva question for your exam.